Here we'll talk about respiratory distress syndromes in the neonates. It is because of the inadequate production of surfactant. Normally the surfactant production will peak at 35 weeks of gestational age. But in case of babies who are born before 34 weeks, that is because of the prematurity, you can see this respiratory distress syndrome. So that is one of the cause. Prematurity, it is one of the main cause. And coming to the other causes, it also includes this maternal diabetes. So in case of diabetes, there will be increased insulin, right? So this increased insulin will cause the decreased surfactant production. So maternal diabetes can also be the reason of this respiratory distress syndrome in the neonates. And also C-section. In case of normal vaginal delivery, there will be stress on the fetus, right? So in fetal stress, there will be releasing of this catecholamines in the fetus. So what happens, this catecholamines, it will lead to the surfactant production. But in case of C-section, there will be reduced fetal stress. So it will lead to the reduced catecholamines production, which will lead to the reduced surfactant production. So it is one of the reasons for RDS, right? And other reasons include this asphyxia, acidosis, and also different things. So these are the different causes. If we summarize the different causes, one is because of the prematurity. The surfactant production will be peaking at the age of 35 weeks of gestational period. Right? So the baby born before this 34 weeks, remember this, before the 34 weeks of gestational age, you can see this respiratory distress syndrome. And also if the mother has diabetes, and also if the baby is taken out by this LSCS, right? Because of the decreased stress and decreased release of catecholamines, you can see this decreased surfactant production and other things like asphyxia and the acidosis, right? So next point is lecithin by sphingomyelin ratio is less than 1.5 will lead to the decreased surfactant production. So in normal child or the normal baby, this lecithin by sphingomyelin ratio will be greater than 2. But in case of this RDS, you can see the ratio less than 1.5. Right? So it will also lead to the decreased surfactant production because the surfactant is made up of these components like lecithin and sphingomyelin, right? So the ratio, if it is less, will lead to the less production of surfactant. So here if you see the pathogenesis, there will be alveolar collapse during expiration. So the baby puts more effort. So this more effort can be seen as this clinical features like tachypnea, where the respiratory rate will be increasing, and also retractions can be seen, grunting, cyanosis, and decreased airway entry. Right, so these are all the different clinical features which are correlating to the efforts put by the baby, right? So which will ultimately lead to acidosis, stunting, pulmonary vasoconstriction, hypoxemia, and formation of hyaline membrane. See, there is collapse of alveolar walls, right? So the baby has to put more efforts in order to obtain more oxygen. So the baby is putting efforts which can be seen as retractions, grunting, cyanosis, and tachypnea. Done? So what happens after putting so much of efforts? Ultimately, it will lead to acidosis, stunting, and decreased oxygen to the tissues, hypoxemia and all. And also it can also lead to pulmonary vasoconstriction and all. And later it will lead to formation of hyaline membrane. So this respiratory distress syndrome is also known as hyaline membrane disease because there will be formation of hyaline membrane. Decrease in the surfactant, increase in the hyaline membrane. Right, in case of this chest x-ray, if you perform it in the baby, you can see this ground glass appearance and also air bronchogram. These are the different findings. Management is based on the Silverman score. If it is mild, that means less than 5, and moderate 5 to 7, and severe greater than 7. If it is a mild case or the moderate case, you go for CPAP, right? If it is a moderate case or the severe case, you go for SRP. If it is severe, that means greater than 7, you go for mechanical ventilation. So this first two, you go for CPAP. For second two, you go for SRT. And the last one, you go for mechanical ventilation. So let us see what is CPAP. It is continuous positive airway pressure. So here you provide this continuous positive airway pressure. So this pressure of 5 to 7 centimeters of H2O is maintained. So positive end expiratory pressure of 5 to 7 centimeters of H2O2 is maintained. It is to keep this alveolar open. So what is the main pathogenesis? The alveolar collapse leading to more efforts by the baby, which can lead to acidosis, hypoxemia and all, right? So here we are trying to keep this alveoli open. This is CPAP, continuous positive airway pressure. Now coming to SRT. Two types of surfactant, one is natural and second is synthetic. In the natural, bovine outbreaks. In the synthetic, it can obtain by recombination. How can you give the surfactant? It is by two methods. One is insure and second is by catheter. So in the insure, first you'll do this intubation. So first you'll provide this tube and then you'll give the surfactant and then you'll remove this tube. That is extubation, right? So intubation, you'll provide the surfactant and then you'll remove the tube. That is extubation. So this is a insure method. And the second method by which you can also provide the surfactant is by using catheter. So tracheal catheter can also be used. So these are the SRT. And now coming to prevention. So it can be prevented by mother taking steroids, in the antenatal steroids, right, in mother. And let us see the difference between ARDS and NRDS. So what do you mean by ARDS? It is acute respiratory distress syndrome. So how is it different from this neonatal respiratory distress syndrome? So what is happening in the neonatal respiratory distress syndrome? There will be decreased production of surfactant, right? In case of this acute respiratory distress syndrome, there will be alveolar insult. So there will be some injury to the alveolus, which will lead to the damage of the alveolar wall, which will lead to the collapse of the alveoli. Not because of the decreased production of surfactant. Here it is because of the decreased production of surfactant, but here it is because of this alveolar insult. I just want you to know the difference between acute respiratory distress syndrome and the neonatal respiratory distress syndrome. So if you see the pathogenesis of this ARDS, first there will be alveolar insult, right? So alveolar damage, which can be because of this injury or the gastric acid aspiration or etc. And then which will lead to inflammatory response. Once there is injury, there will be inflammatory response, right? So this inflammatory response will attract many neutrophils. So once the neutrophils are recruited, releases this proteases, fibrins and all. So which will form this hyaline membrane. So this hyaline membrane will replace the surfactant. So what is happening in ARDS? Suppose imagine this is a lung and this is the wall of the lung, right? So normally it is coated by the surfactant. But in case of any injury to the lung, there will be destruction of this alveolar wall and all, which will lead to the production of hyaline membrane, right? The hyaline membrane will replace the surfactant, which will ultimately lead to reduced surfactant. Reduced surfactant will cause increased surface tension. Increased surface tension will decrease the lung compliance, which will lead to atelectasis and shunting. So this is about NRDS. If we summarize the whole thing, so what is NRDS? It is neonatal respiratory distress syndrome. It is because of the surfactant production is decreased. Why it is decreased? The baby is born prematurely. That means before 34 weeks of gestational age. And also other factors include maternal diabetes, LSCs, asphyxia, acidosis and all. And lecithin by sphingomyelin is less than 1.5. And what if you see the pathogenesis? There will be collapse of alveolar wall. Baby puts more effort, which can be seen as retractions, grunting, cyanosis, tachypnea, which will ultimately lead to acidosis, hypoxemia, shunting, pulmonary vasoconstriction, right? And also you can see two things in this RDS, which is atelectasis and shunting, right? What do you mean by shunting? There will be decreased oxygen supply to the tissues. And in the atelectasis, you cannot properly breathe, right? And in the X-ray findings, you can see ground glass appearance. And according to the Silverman's cone, you will manage the treatment. In the mild and moderate, you will do CPAP. In the moderate and severe, you will do SRT. In the severe, you will go for mechanical ventilation. What is CPAP? Continuous positive airway pressure. SRT, you provide the surfactant by two ways. One is insure and other is by catheter. Intubation, providing surfactant, and extubation, right? So this is about it. Bye.